Melasma is a skin condition that affects predominantly the forehead and cheeks, usually of women of a childbearing age, so somewhere between teens, 20s, and 30s. It's often seen after a woman has had a pregnancy, but it can also occur with hormonal contraception. And what happens is there's an increase in pigment in these bony prominences. And this pigmentation will contrast with the natural skin color, causing a darkened appearance. Although melasma does not shorten your life expectancy and shouldn't cause you any pain, because it changes the appearance of your skin, it can be incredibly distressing. And this burden of distress can have a knock on effect on the quality of your life. Melasma is considered to be a really complex interplay between female hormones. Usually progesterone is the main hormone implicated, but estrogen can also play a part, and the sunlight and a genetic predisposition. So current understanding is there's an increase in female hormone, and this relationship with visible light from the sun causes a patterned increase in pigmentation, usually over the bony prominences of the face, so forehead and cheeks. The treatment of melasma is quite complex, but essentially boils down to two areas. The most important and number one thing to do is to protect the skin from tanning. This means avoiding sunbathing, avoiding anything that can tan the skin, and using protection from sun tanning. So this includes sunscreen, and in particular sunscreen that blocks visible light, as well as using physical sun protectant such as wide brimmed hats and sunglasses. So that's the number one thing that you can do to improve the appearance of melasma. Next, as dermatologists, we discuss the induction of remission of the melasma and then the maintenance of that remission of melasma. So in order to induce remission, we usually recommend using topical treatments that reduce pigmentation, the hyperpigmentation in the skin. And there are a variety of different ways of using these different ingredients. These ingredients can often be quite irritating and often not to be used as long-term non-stop treatments. So we normally induce remission over a period of 4 to 6 weeks. And then you need to try and maintain the remission. And that's using non-irritant topical treatments to try and prevent the increase in pigment from coming back. As we learn more and more about this condition, there are more and more different treatments available. And now there are also treatments that can be used by mouth. And as usual, you will hear about laser therapy as an option to try and induce remission of melasma. But it's important to note that this laser therapy must be used by people who have familiarity in treating melasma in a wide range of different skin tones. So always ask a laser therapist if they're familiar in how to treat your skin tone and your type of melasma. It's also really important to say that although there isn't a cure for melasma, so there isn't a treatment that takes it away forever, it can be well managed so that it doesn't take over the quality of your life. You can manage melasma on the face, first of all, with using your sunscreen that prevents visible light from getting through. You can also use topical preparations and oral preparations that can help reduce the increase in pigmentation on the face. And then there are also treatments that we would recommend to use long term to try and reduce pigment from coming back. In terms of lifestyle, if you're using hormonal contraception, it may be worth looking for a non-hormonal contraception to see if that can help the appearance of your melasma. I also recommend my patients with melasma try camouflage. So that includes using certain types of makeups, concealers, foundations that can help improve the appearance of the melasma on the skin. present time, there is not a permanent cure for melasma. However, many people do find that with time and with age, their melasma may improve spontaneously on its own. A lot of people also find that their melasma improves with treatments and using sunscreen diligently all year round, so in the winter as well as throughout summer and spring months. If you notice that your melasma was really triggered by pregnancy, as you move, after having the baby, as you move further and further away from the pregnancy, there may also be a gradual improvement in the appearance of melasma. So for many people with melasma, the melasma can gradually improve as time passes. For a small minority, they may find that their melasma is something that's very difficult to find improvement without active treatment being used, with bursts of active treatment and breaks from that active treatment. Melasma is overwhelmingly a condition of women, and it is a condition of women of childbearing years, so mid-teens until about mid-40s. We believe this is because melasma is triggered by a complex interplay between female hormones, the sun, and pigment cells known as melanocytes. However, having said all of that, we do have cases of men who develop melasma. So although it is predominantly seen in women, I would always urge any men who notice an increase in pigmentation, particularly over the forehead and cheeks, have an assessment with a dermatologist with a view to a diagnosis of why they're getting this increase in pigmentation.